So the research shows that the first time a woman attempts to have penetrative sex again postpartum, the rate of her having pain and discomfort is at 87%.
Whoa.
It's huge. And then that rate gradually gets a little bit better at about 6 months postpartum, but we're still in like the high 60% of having pain.
This is Raising Mama, a hilariously honest podcast dedicated to unveiling the hidden realities of motherhood.
Our goal is to arm you with the information and tools you need to be your most confident and empowered self.
This podcast is packed with unfiltered testimonies, diverse perspectives, and expert opinions, along with a good dose of laughter and tears.
Leading you on this journey is my best friend, Megan Stander, who is a CEO, passionate maternal health advocate, and mom of 2 daughters.
Alongside me is my best friend, Chelsea Ledson, who is a mother, wife, and registered nurse with her master's specializing in women's health. Let's try to raise the next generation
by raising up mamas
and maybe raising a little hell.
Hey, y'all.
Hey, mamas.
Welcome back to Raising Mama. On today's episode, we have Dr. Christine Pieton, and you guys, she is a pelvic floor specialist. So I know we all don't want to pee when we sneeze, but she has so much more important info than that, more about pelvic health than I ever knew. She is a sports and women's health physical therapist who specializes in pelvic health across our lifespan, with a special affinity for prenatal and postpartum care. Hence our podcast. She will also help us return to exercise, rehabilitate those pelvic floors so that everything's working as best as they can. She is about helping women feel strong and confident from the inside out, so they can live their lives to the fullest without letting common aches, pains, and leaks get in the way. Women deserve so much more support throughout their reproductive years and beyond, which is why she's on a mission to help more women feel more informed and empowered about their pelvic health. Together, we can change the conversation from, why don't I know about this important information, to, I'm so glad I know what I can do and teach my daughters too. So welcome. I'm so excited to have you on today because we have questions.
Thank you so much. Really excited to have this conversation, and thank you for using your platform to also help share more information about pelvic health. Together, we can change that combo.
So fascinating topic. I, for one, did not know much about my pelvic floor until I had kids. And I think that there might be listeners sort of in the same position. I mean, they've probably heard of the term, but just to get it out of the way, what is your pelvic floor? And how did you get into this profession of specializing in it?
All great questions. So to echo what you said, Megan, most people do not know about their pelvic floor. And let's be real, no one was ever given a good introduction. So I often, when I meet my patients in my office, I honestly start with that line. I go, look, let's introduce you to this part of your body because I'm sure you didn't get a good introduction. And I would like to be that steward to give you a good one. Your pelvic floor is this really important group of muscles that sits inside of your pelvic bowl and literally holds up all of our internal organs. And it serves a lot of really important functions. And also to let you all know, every single human has one. Yes, a lot of people think about it in terms of prenatal and postpartum because that's a time when this area of our body gets asked to do a lot more than the average time. But it is not the only time that our pelvic floor is important. But that's usually when people start to notice that their lack of knowledge in this area is something that they want to pay more attention to because it's starting to show up in some different ways in terms of symptoms, pain, discomfort, etc. So it kind of brings a different attention, I would argue, to this area. But that big group of muscles, being the pelvic floor that sits inside of the base of the pelvis, it serves, some important functions. 1, bowel and bladder control. 2, sexual function. 3, it is a possible channel for birth. And then number 4, it is the literal foundation of our core team of muscles that helps our body to be supported while we are in motion. That last part is what most people don't know. And so when I talk about the core team with my patients, I'm not just talking about your abdominal muscles. It's the abdominal muscles, your spinal muscles, your diaphragm, that main breathing muscle in the base of your rib cage, and the pelvic floor. All
Oh.
4 of them together are collectively your core team for our body that allows us to have support while we do all the things. So this is where pelvic floor symptoms can start to show up when that core team is not working optimally. And pregnancy and postpartum challenge these areas a heck of a lot, for the more obvious of growing a human, but then also these sudden changes postpartum after we've had a baby and the body needing time to recover and rebuild while we're also taking care of a little one full time. So I know you have a second question of how did I get into this, but I want to pause there and go, what questions do you have based on that first part before I dive into how did I even get into this whole thing of pelvic floor PT, which was a total accident, by the way.
I've been a nurse for 5 years. I took anatomy, and every single time somebody says pelvic floor, in my mind I think of a floor. And I'm like, is it
Great.
the bottom of your bladder, the bottom of your uterus? Even for me, it's such a really odd thing to conceptualize, and I feel like you did an amazing job. I'm like, oh, it's all the muscles that hold everything up, that I'm gonna use that now.
I mean, it makes sense, right? Because it's in you, what did you call it? The pelvic bowl?
The
Yeah,
bowl?
it's
Yeah.
it's so in there, and I feel like
It's right up in there.
I am giving my laywoman's interpretation of this right now.
Totally.
So I just think because we don't see it, can you see it? Can you see it?
So
If I were to spread eagle right now, would you be able to
visualize some things? Technically, you're going to be seeing you're going to see the vulva, which is the external area, right?
Right.
And I'm going to point this out also because a lot of the general public uses the word vagina to refer to everything down there. And that's technically incorrect. Not to make anybody feel bad, but wanting to educate you all about your lovely anatomy. So the external area that we can see visually is the vulva. And then
Right.
depending on each person's kind of the size of the opening of their vaginal canal, which technically is called the introitus. So that is a little bit wider for people typically after they've had a vaginal birth. So sometimes when I'm visually doing an inspection of that area with a patient, I'm looking at all of the external tissues of the vulva, also looking at, if we've had any injuries in and around that area or any pain and symptoms that my patients are experiencing. And then visually, I can start to see a little bit into the vaginal canal. So can I still see technically the muscles in that way? No. But to your point, it's actually much more, superficial to kind of that bottom part of the pelvis than most people think. And then it's a much thicker group of muscles also than most people think because it's having to do a ton of supporting underneath all of the other structures that I just mentioned. So I call it this very supportive muscular hammock that's holding everything up is one metaphor that I use. And then the other metaphor that I use is also that it's honestly really designed like a trampoline. So if you think of a trampoline, there's a certain amount of supportive tension that is just there at rest, that's functioning to support all of the things I mentioned. And then we also need it to be flexible to shock absorb as we are going through life, to be able to help us to move well, to be able to suddenly respond with a cough or a sneeze, etc. And so we need it to actually be able to contract a little bit more when those things need to happen, like a cough or sneeze or a jump. And then also we need to be able to more fully lengthen beyond that kind of resting typical tone for things like needing to go to the bathroom or intimacy and birth as just a few examples. So she needs to be able to oscillate through these different phases depending on what's going on. And if she's not able to, that's when we also have pelvic floor symptoms. So we don't want too much tension. We don't want too much laxity. We need to be able to fluctuate between all of those. And that's also based on her relationship with all of those other core team mates that I mentioned, and also our hip muscles themselves. So the pelvic floor does not work on her own island. She works with a team. And so this is also what I'm looking at and educating my patients when people are coming in with pelvic floor symptoms, I'm looking and wanting to assess and evaluate at the pelvic floor specifically to say, hey, what's going on there? But then I'm also going, hey, I need to look and assess all of your teammates, because
Yeah.
a lot of times we think that the pelvic floor is the primary problem and she's getting blamed for all of the issues. But a lot of times it's that she's trying to sub in for the other teammates that actually need help, and she's
Mm.
getting the blame.
Okay, here's my question that I'm dying to ask. So, seeing as
Yeah.
I barely know nothing, and I'm even remotely in this, when do
Yeah.
people I feel like probably when people come to you, it's extreme because that's what prompted them to even seek you out. So, by the time someone comes to you, what are like the top, 3 common things that are motivating them to like research what the pelvic floor is, research how they can fix it? What's motivating people to explore this?
So, to be honest, a lot of it is shame and embarrassment that these things are happening and they
Mhm.
don't know what to do about it, or they hoped that it would kind of just go away in a little bit and it's still not going away. And so that also starts to kind of create some other motivation for people typically to want to solve that problem.
Mm.
But then I also have people that have been motivated because they have other women in their lives that have had these issues, and they've been, they've seen the impact of that. And so they come in a little bit more proactively as well. And then in my community, what's been really beautiful is that specifically in the prenatal and postpartum community of where I live, so many other moms are advocating for their mom friends to be like, hey, this is something you need to know about. We're not talking about this enough. Nobody told me, but like, I want to change that convo. Go seek this out. Go learn about this. Don't let this be something that is an afterthought. And so
Mm.
that's been another really beautiful way of motivating, where sometimes my patients go in going, hey, I was told that I need to learn about this and I don't know what I don't know and I would like to learn so I can be proactive, all the way to, hey, I am having symptoms and I want to be more proactive about it than I would have been.
Wow, that's
Yeah, that makes a lot
excellent.
of sense. I remember when we had Jenny Tucker on the podcast, and she was talking
Yeah,
about her journey with postpartum depression, and one of the things that she
totally.
was like enraged about was that she needed a pelvic floor therapist, and she was like, why is this not a part of like routine standard care?
It deserves to be.
Yeah, I imagine if you gave birth through a penis, like all the doctors would be like, so let's right after have reconstructive, think about how do we fix, you know what I mean? Like it's insane to
100%.
think about it, any other body part that you'd have to be that augmented and changed and to just do nothing for it. It's like people pay more attention to their
Totally.
eyelashes. So it's
I used
totally
to
in
be
my
one of those
practice.
people.
Well, and Chelsea, like you bring up such a great point, right? And even to your point that you made earlier, like you're like, I'm a medical provider. I've done advanced anatomy. We didn't really talk about this. I didn't get a really, I don't feel like I even got a good visual of what this anatomy looks like. And Chelsea, I'm with you. I went through 3 years of graduate school training to get my doctorate in physical therapy. We went through a cadaver lab, anatomy lab, all of the things. I got tested on all of it. There was zero discussion or even a picture about the pelvic floor. And you're like, that I argue
Really?
is one of the most important groups of muscles based on the fact of even just thinking about the core team that I mentioned. So,
Mhm.
my responsibility as a PT is to be able to say, hey, if somebody's having shoulder pain, for example, I need to be able to evaluate the shoulder. I also need to know that, oh, there's a lot of common muscles that attach to the neck. So, I need to be able to know how to screen the neck. And I also need to be looking at the spine because that's all nearby to do what we call differential diagnosis to make sure where is the actual problem coming from or the symptom. So then if you think about that real fast, where I'm having symptoms and I need to know the very close neighbors to make sure that I'm looking at enough things of the evaluation. Now, if we go down to the pelvis, right? So I learned all about the hip, I learned all about the back, I learned all about the abdominal team, but then we're just going to pretend that the pelvic floor is not there.
Why do you think that is?
I have a lot of questions. My assumption is that it's a very intimate part of the body.
Mm.
I think we feel uncomfortable bringing it up and talking about it. I think that also we have a challenge in the sense of acknowledging its importance. And I think even though every human has one, it still kind of more so falls under women's health because of the reproductive impact. And so I think that this sadly is another piece where there is an underserved amount of education and research. It's improving, but we still have a long ways to go to acknowledge its importance within the medical model.
Right.
And so in that way, as usually research, once we have it kind of confirmed, it's like another 20 years before it's actually in practice. And women have only really been included in research in the last 30 and change years. So there's a lot of layers there. And I'm not saying that even in PT school or even in medical school that like we need to have, weeks and weeks of knowledge about this, but we need to know how to ask some basic questions. We need to be able to screen a few of these basic functions. And then there needs to be education, even in the physician level, to know that pelvic floor PTs even exist. That's a huge deficit too. A lot of that knowledge of provider referral is not even well known. So then you can imagine how many individuals, general public, are going through the system if they're brave enough to bring up pelvic floor symptoms. How many of them actually get the appropriate referral? Because physicians aren't being educated on this, and so therefore they don't know then where to send people.
Right.
So it becomes really problematic really quickly. And so this is also part of my personal and professional mission of acknowledging that issue in the system, not trying to point fingers just at the physician or anybody, but being like, hey, there's a big problem here. My point of where I'm pointing is going general education, both in the medical model and out in the general public. And pelvic health does not have to just be from a sexual lens. It's like overall
Totally.
health.
If you were just like listening to this podcast and you're like, great, cool. What are just some very basic things that people could do to just be more aware or take care of or, maintain their pelvic floor health?
I really want to talk about prenatal and postpartum care too, because I know like a lot of our listeners are pregnant or had just had a baby. So like let's talk about why this is relevant to both prenatal and postpartum care, and why having someone like you like on the care team, why that would be important.
Totally. So, from the prenatal side, like if I had a magic wand to say, hey, here's what I would love for every single person, one, it should be that a pelvic floor PT is part of your prenatal team of providers. So you have your birthing provider, whether it's your OB or a midwife. And then as soon as you are starting those prenatal visits, ideally, I would love every single individual to also be starting their prenatal care with a pelvic floor PT. And I'm talking not just if you're having symptoms, I'm talking out of the gate to be monitoring and being proactive with you. There will be some people that are already having symptoms when they first get pregnant, but in the very beginning, like starting in your first trimester, connect with a pelvic floor PT. Yeah. To educate you. What is your pelvic floor? How is it connected with other things? What is your pelvic floor's current baseline? Are we optimal right now, even though we got pregnant, or do we have some work that would be helpful to support what's going to continue to be asked to do a lot more work into your second and your third trimester? Pelvic floor symptoms for women in general, 1 in 3 women across our lifetime will have pelvic floor symptoms. And I argue that those statistics are significantly underreported. So a lot of people are already experiencing pelvic floor symptoms before they get pregnant. And then those symptoms become exacerbated through pregnancy without support. And then we can imagine then how that's going to go postpartum. So investing and having a pelvic floor PT on your team prenatally helps to mitigate a lot of things. It also helps you to be educated on your body. I argue, I'm looking and supporting my patients both of educating them, helping them understand how to continue to stay active through their pregnancy in supportive ways for them, take the guesswork out of what is helpful for their body, what they can be doing proactively for each trimester, how to adjust movement if we need to as their body is continuing to grow their little one. Also being able to be proactive with them if things do start to pop up, like the common aches, pains, low back pain, hip pain, leaking a little when I cough and sneeze, oh, I'm going to the bathroom all the time because now I'm just pregnant and that's how it goes. And I go, I know that these things get normalized, but those are all symptoms that the pelvic floor is getting overloaded beyond its current baseline. And those things can be improved. And then all the way through, even from birth prep. So I do a ton of birth prep with patients in their third trimester to help them understand how to prepare their pelvic floor, how to use their breath to be able to create length there for the big event that's coming. Also addressing hip tension and tightness, because that's super common as we get into later parts of pregnancy. But if we have a lot of hip tension, that's going to create more tension in the pelvic floor, which is going to make it harder to have baby come through easily, which then also increases our risk for more significant pelvic floor tears. I'm also educating patients on how to use their breath, how to use movement while they're laboring, how to understand how different positions can be helpful for their body to create more space in the places that we need it as labor is progressing, but also for pushing, and educating partners on these different things too, as just a few pieces. And then postpartum, shifting into other things. But I'll pause there and go, what questions do you have prenatally? And then I'll dive into the postpartum part.
Yeah, so it sounds like there's just a laundry list of things that can go wrong here, right? And well, I mean, I don't wanna, like, scare people, but, like, there's a laundry
Totally.
list of reasons why having a
There we
pelvic
go.
floor therapist on your team can be
Yeah,
beneficial to you, and, like, all of the things that it can help prevent or treat early on or so on and so forth.
totally.
But there's a scary stat too. Like, I think, when we were talking before, you mentioned that you're like 40 there's a 45%, um
Increase. Yeah,
yeah, increase, there's like a higher PPD rate with incontinence, which makes total sense because,
correct.
I mean, incontinence is not only physical, I mean, it's mental.
Totally. It's a significant, impact to people's confidence and their ability to feel strong in their body, and to also feel like they're always having to kind of hide that this thing is going on, and how much of a mental load that adds to the already existing mental load of, we'll talk motherhood in this case, right?
Mhm.
And just the minimizing of it. And also, sadly, how often women will bring this up in their postpartum visits or follow up just annual women's exams with their gynecologist. And these symptoms are actually dismissed by the providers too. They're like, yeah, well, you had a baby. Like, yep, that just is part of motherhood. Like, I go, full stop. Your pelvic floor symptoms do not have to be your cost of admission into motherhood, period. They are solvable, they are fixable. And a pelvic floor PT is your best person to have on your team to figure out the solutions for that.
Mm.
Because huge parts of this are muscle related. And so we need strength. We need strength training. We need to understand how to utilize those pieces for our pelvic health, but also hello motherhood with all of the heavy lifting that everybody is doing all freaking day. We can't put that in a pill. That doesn't come from a surgery. That doesn't have to be something that you just accept for the next decades of your life. Because, by the way, when we have pelvic floor symptoms, when we are in earlier motherhood, they do not just go away if they are not being addressed. They
Hmm.
gradually worsen. And then when we go through menopause and the hormone changes there, they get further exacerbated again. So I go, I want all women to know earlier on in their lifespan that these things can be addressed, that a pelvic floor PT is someone that you want on your healthcare team in general, but especially prenatally, especially postpartum. But like how we all sort of know, like, oh, we should have a primary care provider on our team to, like, just when things happen. We should also have, a gynecologist if we're ladies. We should also have a pelvic floor PT on our roster to be just addressing those things, or if things pop up, to like have check-ins and or to be able to support those things, so that it doesn't have to be something that's constantly interrupting your life, because pelvic health is overall health, and it's also family health, is how I like to describe it to my patients.
Yeah, that makes a hell of a lot of sense, and it enrages me as well.
I'm with you. Yep, totally. And to
But
your point, Megan, like you were saying on those statistics, so you know the increase rate of postpartum mood disorders increases by 45% when women are suffering with urinary incontinence alone as their pelvic floor symptom postpartum.
Hmm.
And we know that half of women at 1 year postpartum are still suffering with urinary incontinence.
Do women ever have issues like with sex? Like, is that a part of the whole pelvic?
Huge, hugely. Yeah.
What can happen
And that's
there?
the other statistic. So the research shows that the first time a woman attempts to have penetrative sex again postpartum, the rate of her having pain and discomfort is at 87%.
Whoa,
Uh-huh. And
that's a
I'll
lot.
explain why in a second. It's huge. And then that rate gradually gets a little bit better at about 6 months postpartum, but we're still in like the high 60% of having pain and discomfort. And then between 28 to 38% are still having discomfort at 1 year postpartum and beyond. It's
So,
huge.
and it's the pelvic floor is enhancing the pain? Like, because your trampoline's not bouncing as it should or something?
So the trampoline's not working optimally. And then my follow up is why? So lots of reasons can be because of this. One, we can have a lot of hip tension and tightness that's not allowing that pelvic floor to trampoline like we need it to. We can also have pelvic floor muscle tears that occur during birth, which we have a very high prevalence of. And then that creates scar tissue in and around that area of where that injury happened, which more often is around the vaginal opening down through the perineum, which needs to stretch and rebound and trampoline quite a bit for things to be functional for day to day life, but also any type of inserting into a canal.
Hmm.
So, if that's not able to stretch well because that scar tissue is so bound up, that's going to create pain and discomfort and not allow those muscles to stretch like they need to, which is not going to make intimacy feel comfortable, both with initial penetration as well as deeper inside or a combination of both. Not to overly simplify it, but just to give those kind of two examples. The
Mhm,
other
mhm.
big complication here that does not get enough airtime is also the change in hormones that are happening. So if someone is nursing and lactating, hormonally, prolactin levels increase and estrogen levels drop in order for that milk production to be maintained. Estrogen is a really important hormone for our pelvic floor tissues. They are what is important for the natural lubrication of that vaginal canal and the vulva tissues, and also circulatory support to those tissues. So if we have tissues that are dried out and not getting enough blood flow, how's sex going to feel?
Mm.
Not that great. And so this is another big piece that a lot of people don't know about. And so this kind of drier environment is often very common throughout the duration that someone is nursing, and everyone's nursing journey is going to be for a different time frame,
Yeah, it could be a really long time frame.
right? And the solution for this is actually very simple. It's topical estrogen. It's a prescription that physicians can write, and you put that into the tissues, both intravaginally as well as externally around the vulva. And this can drastically improve if that's the only reason that we're having pain. But I'll tell you, usually it's multifactorial.
Mm.
Usually we have other things that need to be looked at. But I'm educating patients on topical estrogen. We're addressing if we have any scar tissue and different things like that to help those tissues become flexible again. We're
Mm.
then also working on muscle strength and coordination so that trampoline can move well. And then I'm also looking at, hey, how are your hips doing and all those kinds of things because you just grew a human for 9 months. There's been a lot of things going on and changing through there so that that relationship also needs to be restored.
Hmm.
So when we talk about it even just from that standpoint, you're like, oh yeah, no wonder there's so much like pelvic floor symptoms, so much pain with intimacy, all of those different things. Because all the pieces I just mentioned about pain with sex and what can be causing that are also reasons why people will also be, having urinary incontinence because we don't have enough strength in the muscles. We have scar tissue that's not allowing that pelvic floor to respond and rebound when we need it to, for example. So, all of these symptoms, it's very rare for my patients to come in and be like, I'm just having this one symptom here. It's
Mhm,
usually
mhm.
this cluster. And so the good news is when you come in for pelvic floor PT, we're addressing all of that as one go. We don't have to
Right,
be
right.
addressing them as different units, but this is why this is such a big issue, and we're not talking enough about it. And these things impact our quality of life so drastically.
Yeah, it makes me sad because I feel like when you were mentioning the the pain during sex aspect, and like I just feel
Mhm.
like just in general, like culturally, like women's pleasure during sex, let alone like the absence of pain during sex is just not
Correct.
valued, and it's almost like normalized, and it's just like, well,
It
maybe that's
is.
just how it is for you,
Totally.
and so I think it's like so empowering for a woman to place importance on that for herself, because nobody
100%.
else, well, maybe not nobody else, hopefully her partner, but
Yeah,
it's not like guaranteed that other people are going to be advocating for that because there is such a stigma around it for like women, I guess, as it is, right?
totally.
So, but I want to talk about like the kind of, at this point, sort of almost infamous 6-week checkup that women have postpartum. And I say that because at least within our space of like, postpartum care, it's talked about a lot because it's like the shining example of how postpartum care is not in fact care in the medical world. So,
Totally.
what are your thoughts on that on that checkup?
How much time do we have on the podcast?
Mhm.
So here's how I like to phrase it. The 6-week all clear is letting us know that we are all clear of any signs of infection. That's about it. And that's also where the traditional insurance model says, hey, insurance says, we're good, we're done, we did our job, we paid for all of your prenatal things. We need that provider to give us the all clear. Now we can kind of close that book and our job is done. And that's why the 6-week all clear is at that time. But
Mm.
tissues are not done healing. Tissues heal on 12-week cycles, trimesters, once again. So when we are clearing, air quotes, women at 6 weeks postpartum, I go, that is really unclear to the general public because you've just told them that they can go back to exercise and sex and basically pretend like they didn't just go through 9 months of growing a human. And also, we're not going to acknowledge whatever birthing injury that you went through, whether you had a significant abdominal surgery through a C section or had a vaginal birth with some type of tearing, being, you know, almost 50% of people that have a vaginal birth are going to have some type of second degree tear or more, which means that we have pelvic floor muscle injuries
Hmm.
occurring. They are nowhere near done at 6 weeks. The top layer of tissue, the wound has closed, but we haven't restored flexibility, range of motion, or strength to all of those tissues. That takes way longer and also takes a rehab provider like myself to guide you through that. If you had
Yeah.
any other medical surgery or injury, for example, if you have knee surgery, like I tore my ACL, which is a pretty common sports injury. You are supposed to you go through your surgery, you're having follow-up with your surgeon, usually day 2 to 3, week 1 to 1.5 post-op. You're usually having another one at like 3 to 4 weeks, 6 weeks, 12. I had follow-ups all the way to 1 year for my knee. But we tell women that they've had birth, they've grown a human, they've given birth. That's a natural event. So we're going to clear you at 6 weeks. Your tissues aren't done yet, but we're going to tell you that you're all good. And bye, good luck with all of that. And then we wonder why we have such significant pelvic floor dysfunction prevalence and rates throughout our society. And also, why does having a baby not qualify for having a rehab provider on your team to make sure that all of those things are moving and functioning well? I don't expect physicians to have to go through all the training that I did to know how to guide somebody from a rehab standpoint and movement. Just like I don't know how to deliver the baby or to monitor all the way through. but both of us are valuable on someone's healthcare team. It should be, okay, at the very bare minimum, we've made sure that there's no infection. And also, instead of just clearing somebody for sex and exercise without any movement assessment,
Mm-hmm.
let's make sure that there's a movement provider on the team to make sure that those tissues are ready for all of that type of moving. It should be a tag team effort,
It's so logical that it's like almost weird to just hear it. You're like, yeah,
right?
like,
Yeah.
duh,
Like, no, duh.
any other
Yeah.
thing. But you're
Right.
right. There is just like a lot of self-suffering that is just really normalized. Like, I don't know, suffer
Yeah.
through having a disrupted day and peeing all the time, suffer through feeling like shame around incontinence, suffer through sex and feeling painful, suffer through it
Right.
affecting, of course, your mood and having to like, and it's just crazy
All
because to
of
think
it.
that maybe you could get like an estrogen cream and the amount that that could just enhance your life, or 6 PT
Yes,
sessions and being like, oh, I do this one exercise for 2 minutes on the floor, and these can have drastic impacts for like true quality of life, and not for 6 months, like
totally.
10 the rest of your life. It's insane. It's insane. So I'm logging all this because I'm gonna spread the word. I'm gonna spread the gospel because
Thank you.
yeah.
We need more of it. And honestly, that's why I love talking with more women about this, because that's honestly the beautiful grassroots effort that spreads this really helpful information like wildfire, rather than
Yeah,
Mhm.
trying to do it into the medical system and downward. That's going to take a
right.
billion freaking years.
You need
So
to create a demand.
yeah, right? And just advocating for our fellow ladies, being like, look, this does not need to continue the way that it's continuing. The fact that the care that my mom got 38 years ago is no different than what my generations and my girlfriends and patients who are having babies now, like, we still haven't changed the model here. That's not
Mhm.
okay. When we have better information, we should do better in terms of what we're defining as the standard of care here. And so the other really big piece that I'm often advocating and encouraging is saying, hey, on the baby registries, can we start normalizing services that we're contributing to instead of just stuff? Can we put a pelvic floor PT fund on somebody's registry? Can we put that with the doula fund and, postpartum, care, or just whatever would be important, but instead of just stuff? Can we start to
Mhm.
put services on registries? Because that
Totally.
also
Yeah.
helps to educate about the importance of these other services. To also say, hey, that helps educate other people. When you click on the registry, you're like, oh, what's that? That's interesting, right?
It's
These
true.
are other ways that we can start to support in these ways, because I know that finances can be challenging for why people can't access pelvic floor PT at times. And I go, that doesn't have to be a barrier. We can get creative. And then
Well,
on the
and you
other
have an
side of that,
entire YouTube channel, so it's like there's also
yeah,
people like you out there who are like, "Please, let me just give you everything I got." Like, all your videos are super
totally.
informative if you wanna get into the
Thanks.
specifics, because it's like, if you probably
Yeah.
are having any of these symptoms, you have a full-blown, it's maybe not individualized, but it's like, it's just
It'll still
fantastic
give
that
you a good starting point to be able to like
yeah.
start to understand your body a little bit more, right? And the other big piece, back to like, hey, how can we be doing better prenatally, right? Something that I have started doing in my practice, and I'm going to be evolving this a little bit more, is actually encouraging my prenatal patients to bring their partners
Mm,
to some of their PT appointments, to learn about their body, to learn about what their body's going through, to be able to take away some of the education mental burden of communicating back and forth, because it's a lot of work growing a human, and all of the education is being directed at the person who's pregnant, which makes sense. But then it's like, that's another big burden where she's taking in all this information. She's having to learn about all these changes about her body, and then try to communicate some of that to a partner where it's like, hey, how about we just involve them differently from the beginning? Let's educate them about some of the stuff that she's going through. Have them be able to ask some questions. Have them be able to start to expand their education and knowledge about their partner and her body, and being like, oh, so yeah, what other things might she need? When I've had my patients do that during our birth prep sessions, it's been a game changer. They
hmm.
ask incredibly intelligent questions. They also start to go, oh, so like pelvic floor PT postpartum is like, we need that. Like even before I even say anything. A lot of times we're like, thank you for thinking of that. We've actually already scheduled her, but like, thanks. Thanks for acknowledging that that's probably going to be important, right? And even for them sometimes to say, well, okay, so like I've heard that there's this 6-week thing. That seems like really early based on what you're explaining and describing. And like if she does have, an injury or like things that go on during birth, like what can we be doing for her instead? So I know, like, again, I'm in the camp of when people have better information, they can make better choices and they usually start to ask better questions and want to learn more. And that is not just for the person who's pregnant, but also for their partners. And so that's the other big piece I think that needs to be discussed and brought in to better educate more of us about this. Yes, more women deserve and need to know about their bodies, but our partners also need to learn and know more about our bodies too, because then it's a team effort in terms of
Totally.
caring about it.
Yeah.
And also the financial piece that can feel really tricky for some individuals of, is this an investment that our family can make or should we make this? And it's hard sometimes, I think for the person who's going to these appointments to come back and have to try to explain and say, yeah, this is important or why is this important versus having me as the healthcare provider to be able to say, hey, let me help explain this to you. This is what's going on. Here's what your partner's going through. What questions do you have? How can I be a good steward to like give you some tools about how you can show up for them?
Totally. Oh man, I feel like we could definitely have like 20 more episodes where we just go into every little thing because my
Yeah.
brain's like, yeah, yeah, yeah. But unfortunately we have
I know,
only
and
limited time.
and we haven't even talked about Kegels yet, which is
I,
like
I can give you my Cliff Note version if you'd like.
Cliff notes on Kegels.
Okay. Kegels are not the only way to strengthen your pelvic floor, nor are they my favorite way to do it.
Well, what's
A
your favorite way?
Kegel, my favorite way is to pick up some weights and
Oh,
to learn how to breathe and to get really good at squats and lunges.
those things.
Those things. Okay.
Megan and I are so excited to
When
do squats and lunges. We're like, oh,
you're like, dang
got
it.
it.
Okay.
Really? It's more important? You're another person telling us it's important? Okay.
Yep.
We'll
Because
do
here's the
them.
thing. If you do a Kegel, all right, 50% of people, so the research says, and I say it's higher, are not doing them correctly. Okay. And our pelvic floor is not designed to just be manually squeezed and then let go. That tells me, hey, what's it doing? And I do use that in an assessment, but it's just to say, hey, does this person have the ability to contract and lengthen? And like, what's the range of motion that we might have here at the pelvic floor for that trampoline assessment, right? But that does not translate into real life when you are walking around, picking stuff up, having a cough or a sneeze or whatever. So we're not training your brain to know when that pelvic floor needs to respond versus wait for you to manually squeeze her.
Right.
Right. Yeah. It's usually
So,
subconscious.
yeah, the pelvic floor is designed to be an anticipatory muscle where your brain is mostly unconsciously controlling it to respond with all of the other things that's going on because it's getting signals from your diaphragm, your abdominal wall, your spinal muscles, and your hip muscles based on how you're moving and jiving. So training those with your breath and getting more strength in those areas for what I call functional day-to-day tasks is going to have better long-term carryover for your pelvic floor to know how to show up rather than you being in a static position, sitting, lying down, whatever, learning how to squeeze your pelvic floor for a million times, as people are sometimes told or think like, oh, I must just have to do 100 of these a day and then it'll fix the problem. And I go, but that's not teaching your body how to use it in motion, which is where most people are having symptoms. So that's not to say that I don't sometimes help people learn how to connect with their pelvic floor in a stationary position in the very beginning stages, but not as the forever strategy because that's not going to help you in all the places of your life. Plus, I go, We don't got time for that. That's a big waste of people's time to not have actual carryover. So I'm getting people up as quickly as I can, in vertical as quickly as I can, under load and weights as quickly as I can, because that's real life.
Yeah,
Wow.
that makes a lot of sense. Well, thank
So
you. This was a fascinating call. And I'm sure that there are lots of questions swimming through everyone that's listening through their heads right now. So how can people find you? Where can they go? And if they have more questions, if they want to find more information, or if they want to get help.
Totally. So on socials, you can find me at Pieton PT for Instagram. You can also find me on my YouTube channel, which is Move with Dr. Chris. All of this information is also on our pelvicsavvy.com website, where we have a lot of free resources, the links to the YouTube channel. We also have a free monthly newsletter that I send out on a variety of different pelvic health topics. So each month we focus on one particular topic, and I kind of break some things down and help to educate people on these different things and what they can do to improve that part of their pelvic health. So if you want to join our newsletter, you can sign up there too. And if you have any questions or different things or want to connect with me, you can also message me through those different portals as well, to be able to expand your pelvic health toolbox. And if you are local to Santa Barbara and you are looking for a pelvic floor PT to connect with, you can also find my clinic's information through the Pelvic Savvy website as well, and things like that. And if you are wanting to find a pelvic floor PT near you, but you don't live near to Santa Barbara, on that pelvicsavvy.com website, you can also find there is an online directory where you can search by your zip code to find a pelvic floor PT near you. And I also included a couple of interview questions that I recommend using to interview to find the right pelvic floor PT for you, depending on what you're going through. So trying to kind of spread the knowledge and, improve access to pelvic floor PT for everybody. And on that note, I will also say too, it is never too late to connect with a pelvic floor PT. So no matter how long you've been having symptoms, no matter how old your kiddos are, it's never too late to get stronger. So please don't let that be a reason why you don't connect with a pelvic floor PT. Reach out to us so that we can help you, so that these things don't have to continue to be your forever normal, and so that you can, again, feel strong and confident and adventure in all of the ways that you want to for all of your decades of life.
excellent. Thank you so much. We learned so much today, and I'm so proud of all the stuff you're doing and just what a great resource you are, and that you're going to make me an even better nurse. And I'm going to go do my squats
Aw.
and lunges right now.
Woo! There we go. I love it. Yay.
All right.
All
Thank
right.
you
Thank
so
you so
much.
much.
You're welcome.
Thank you for tuning in to the Raising Mama podcast. Your presence means a lot, and we hope you found our discussion insightful.
Become a part of our community. Follow us on Instagram at Raising Mama Podcast. Explore resources on the Raising Mama Village located at www.raisingmama.com.
You're never alone on this motherhood journey. We're here to support you every step of the way.